Coming all the way from California to Pennsylvania and leaving my family behind, and at that time my fiance, it was obviously a very difficult decision to come to Pennsylvania. But you have to consider the quality of the program, and that's important for every prospective resident, is to consider, are you going to have the best clinical, surgical, and academic experience possible? And through extensive research and time, I found that the Reading Hospital experience not only checked all my boxes, but has already taken me above and beyond my surgical requirements, my clinical requirements, and I already feel very comfortable as a podiatric surgeon just starting out in my third year.
We're kind of like a big family. A lot of us support each other. We make sure that all of us are on task, and when we need help, we reach out and help each other out.
We were able to share moments with each other through hard times of treating difficult patients and difficult pathologies, but also be able to enjoy ourselves outside of the workplace and find commonalities to enjoy.
Relationships with the faculty are outstanding. I think one of the highlights of this program is that you get to work very intimately with several different fields in medicine.
We rotate with plastic surgery, vascular, emergency medicine, internal medicine, just to name a few. And when we're on those services, a lot of times we learn how it integrates into podiatry, and we learn the language of those specialties so we can become better physicians.
As a first year, we get the opportunity to see one, and then we do one, and then we teach one as a third year. So throughout these 3 years, the faculty have nurtured us in each phase of our teaching, and it's been really special to have them at our side and guide us through the operating room and surgery, but also in the clinic.
I think we have a lot of autonomy compared to other programs. We get to dictate our own plans when we're rounding in the hospital, and we present it to the attending who, let us know whether or not they agree. Most of the time they do agree. And it teaches us to become better podiatrists in the end because we are able to make those decisions.
The great thing about Reading is that it is one central large hospital, and all of our patient care is done here. So we're able to go to the different units where we see the nursing staff and just the staff in general and other faculty members every day. So we have that close contact with them to be able to streamline the patient care and also communicate our plan to other services.
When you're a resident, or if you're an attending at the hospital, you really come to appreciate working for a hospital that appreciates you by the way they treat you and by the advances and efforts they take to always keep the most up-to-date technology, whether that's through advanced imaging, whether that's through the Epic system that we use here. We've come a long way, certainly with technology, and Reading Hospital never fails to keep up with that.
The ORs are phenomenal at Reading Hospital. They were just redone a couple years ago. They have a camera system in every OR unit where even if you can't see the surgery that's going on, it's on the screen so you can follow along with what the attending is doing. All the instruments and all the tools that we use are all brand new.
I think one activity that we're really proud of here at the hospital is our Hope Rescue mission, where we work with some of the underprivileged patients in the community and help them with their foot and ankle needs and get them set up with the appropriate medical care that they need and deserve.
Another thing that we do is we go to dialysis a couple times a year, and we screen patients for possible podiatric ailments, and we connect them to other providers in the area.
Reading, when it came down to it, was a complete package. From an objective standpoint, I wanted to look to see how many surgical numbers I could accomplish during my training, and Reading exceeded those expectations. We were able to triple and quadruple our numbers that we try to meet in surgical cases.
When I considered this program and researched it, I found that I was going to be able to be very proficient, and even beyond that, in all rear foot and forefoot surgical cases, and be excellent in the clinical setting. So I think if you're looking to be the best podiatric surgeon possible and really go above and beyond, then this is a program for you.